You're 38, maybe 41. You're exhausted. Your mood is all over the place and your body feels different. But perimenopause, that's for women in their late 40s, right? Wrong. Perimenopause can start in your late 30s or early 40s, and most women have no idea because nobody talks about it. You could be years into perimenopause right now, attributing your symptoms to stress or just getting older when it's actually hormonal. So first, let's clear up the biggest misconception about perimenopause. It's not just for women approaching 50. The average age of menopause, when your periods stop completely, is 51. But perimenopause, the transition period before that, typically starts 4 to 10 years earlier. That means many women begin perimenopause in their early to mid-40s. And for some women, it starts even earlier, late 30s. But here's why nobody realizes they're in perimenopause. The symptoms don't look like what you'd expect. You're not having hot flashes. Your periods might still be regular. You're too young. So you and your doctor miss it. The women who recognize perimenopause early have a huge advantage. They can make lifestyle changes, get proper support, and avoid years of suffering through symptoms they don't understand. So let's talk about what to actually look for if you're under 45. The first sign is subtle changes to your menstrual cycle. And I emphasize subtle because these aren't dramatic changes yet. Your cycle might get slightly shorter. Maybe you were always 28 days and now you're 25 or 26 days. Or your periods might get heavier than they used to be, or lighter, or the duration changes. Maybe you used to bleed for 5 days, and now it's 3. Or it used to be 4, and now it's 7. You might notice worse PMS, mood changes, breast tenderness, bloating that's more intense than it used to be, or you might start getting mid-cycle spotting that never happened before. Some women notice their period pain changes, either better or worse than it used to be. Here's what's happening. Your ovaries are starting to become less consistent. Some months, they're producing plenty of estrogen and progesterone. Other months, production is off. This creates irregular hormone levels, even though you're still ovulating regularly and having periods. Progesterone is often the first hormone to decline. When progesterone is low in the second half of your cycle, you might have heavier periods, worse PMS, and shorter cycles. The drop from estrogen to progesterone might be steeper, making PMS symptoms more severe. The key here is that these changes are often dismissed by you and by doctors. You think, my period is a few days shorter, so what? Or PMS is just worse this year because I'm stressed. You don't connect it to early perimenopause because you're under 45 and still having regular cycles. But these subtle shifts are often the canary in the coal mine. They're telling you that hormone production is becoming less consistent, and recognizing this early means you can address it before symptoms become severe. If you're in your late 30s or early 40s and you've noticed changes to your cycle, even small ones, that's persisted for several months, pay attention. This might be your first sign that perimenopause has begun. The second sign is the combination of sleep disruption and mood changes, and these almost always show up together. You start waking up in the middle of the night, often between 2 and 4 a.m., for no apparent reason. Or you're having trouble falling asleep when you never did before. Maybe you're waking up feeling hot or sweaty, but not the dramatic night sweats you associate with menopause. Just uncomfortable warmth that disrupts your sleep. And along with the sleep problems, your mood is different. You're more irritable. Little things set you off. You might be experiencing anxiety that seems to come from nowhere. Some women describe feeling weepy or emotionally fragile. Or you notice you just don't feel like yourself. You're quicker to anger, slower to joy, more prone to overwhelm. Here's the connection. Progesterone has a calming, sedating effect on your brain. It promotes GABA, your calming neurotransmitter. When progesterone declines during perimenopause, two things happen simultaneously. Sleep gets worse, and anxiety increases. Low progesterone means less GABA activity, which means your brain doesn't calm down as easily at night. You lie awake with racing thoughts, or you fall asleep, but wake up and can't get back to sleep. Your nervous system is more activated, less able to downshift into rest mode. That same lack of calming progesterone also affects your daytime mood. You're more reactive, more anxious, more on edge. Your stress resilience decreases. Things that you used to handle fine now feel overwhelming. Estrogen fluctuations compound this. Estrogen affects serotonin, your mood-stabilizing neurotransmitter. When estrogen swings up and down, your mood swings with it. And estrogen also affects body temperature regulation, which is why you might be waking up hot, even though you're not having classic hot flashes. What makes this particularly insidious is that poor sleep makes mood problems worse, and anxiety makes sleep problems worse. You get stuck in a cycle where each problem feeds the other. Most women under 45 experiencing this don't think perimenopause. They think they're stressed. They need to manage their anxiety better. Maybe they should try sleeping pills or antidepressants. And while those interventions can help, if the underlying cause is hormonal fluctuation, addressing the hormones often works better. If you're in your late 30s or early 40s and you've noticed both sleep quality declining and mood becoming more unstable, especially if these showed up around the same time, this is a red flag for early perimenopause. The third sign is a cluster of physical changes. Your body composition shifts, your energy drops, and your libido changes. Let's start with body composition. You notice fat accumulating around your midsection that wasn't there before. Your jeans fit differently, your waist is thicker. And this is happening even though you haven't changed your diet or exercise, or maybe you're even eating better and exercising more, but your body is changing anyway. This is declining estrogen-shifting fat storage from your hips and thighs to your abdomen. It's also increasing insulin resistance, making it harder for your body to handle carbohydrates efficiently. Fat storage becomes easier. Fat burning becomes harder. Declining testosterone. Yes, women need testosterone too, means you're losing muscle mass faster than you used to. Muscle is what keeps your metabolism high. Less muscle means slower metabolism, which means easier weight gain. Then there's energy. You used to power through your day. Now you need afternoon coffee, you're dragging by evening, exercise feels harder than it should. You're tired in a way that sleep doesn't seem to fix. This is partly because of the sleep disruption we talked about, but it's also hormones directly affecting your cellular energy production and stress response. And libido. For many women, this is one of the earliest changes and one of the most distressing. Your sex drive decreases. You're less interested in sex than you used to be. When you do have sex, arousal might take longer, lubrication might be less, orgasm might be more difficult. This is declining testosterone affecting libido directly, declining estrogen affecting vaginal tissue and lubrication, and the combination of fatigue and mood changes making sex the last thing on your mind. Here's what's crucial to understand. All of these physical changes are connected. They're all happening because your hormones are shifting. But if you don't know that, you feel like your body is betraying you. You feel like you're losing control. Women in their late 30s and early 40s experiencing these changes often think they just need to try harder, diet more strictly, exercise more intensely, force themselves to be interested in sex. But trying harder often makes things worse by adding stress that further disrupts hormones. Recognizing that these physical changes are early perimenopause symptoms means you can address them appropriately, supporting your hormones instead of fighting against your body. So if you're under 45 and recognizing these signs, what should you actually do? First, validate your own experience. You're not too young. These symptoms are real. Don't let anyone, including doctors, dismiss you because you're only 38 or 41. Perimenopause can and does start in your late 30s and early 40s for many women. Second, start tracking. Keep a symptom journal. Note your cycle changes, sleep quality, mood, energy, physical changes. This gives you data to show your doctor and helps you see patterns. Third, get hormone testing. Ask for estradiol, progesterone, testosterone, and FSH to be tested at specific points in your cycle. Results might be normal because hormones fluctuate in perimenopause. Sometimes they're high, sometimes low. But testing gives you a baseline and can sometimes catch the fluctuations. Fourth, find a healthcare provider who takes you seriously. Not all doctors understand that perimenopause can start this early. You need someone who listens, who understands the full range of perimenopause symptoms, and who's willing to work with you on solutions. Fifth, make lifestyle changes that support hormones. Prioritize sleep. This is your foundation. Strength train to preserve muscle and support metabolism. Eat adequate protein and manage blood sugar to support insulin sensitivity. Manage stress through whatever works for you. And sixth, consider treatment options. This might be hormone replacement therapy, which can be started early in perimenopause, and often works better when started early. It might be targeted supplementation. It might be medication for specific symptoms. Work with your provider to find what works for your situation. If this was helpful, hit like and subscribe for more women's health content. Comment, are you under 45? And recognizing these signs. Thanks for watching, and trust what your body is telling you.